So the patient, it doesn't so much apply in this case, but there are some patient responsibilities that might be applicable in other cases. So the patient is responsible, that does have some responsibilities for preventing patient harm. So it is important that when they can, that they provide accurate health information so that they are truthful and that they include their existing prescriptions without omitting things on purpose and their medication history. It's also important that they provide instructions on that they follow instructions for medication self-administration. And again, this is all when it is applicable, which it wasn't in this case. For nurses, some of the responsibilities for nurses in this case include, and in all cases include, safe medication administration. So in this case, the nurse, was responsible for ensuring that they were reading the prescription correctly, and a part, that was something that did not happen, and that was part of the nurse's responsibility. Um, Double verification of safe medication administration for high alert medications. So it is not clear if this happened, but you know, it is important for the nurse to verify with maybe a second pair of eyes, um, that it is safe to give a high alert medication. Patient safety is, of course, a responsibility of the nurse. It's a shared responsibility, but it's one of the responsibilities of the nurse. Safe patient handoffs. So, a quote that came from the report that was done by the California Department of Public Health. Um, I'm not sure I mentioned this earlier, but the second nurse said, if I had known that the patient had already received Lovenox, then I wouldn't have administered the second dose because it was too soon to administer a second dose. And they also said that they typically communicate with the other nurse that has cared for the patient, but they did not in this case. And medication reconciliation is also an important responsibility of the nurse. So in this case, the nurse did not maybe review the medications that were recently discontinued as thoroughly. And of course, there are a lot of system factors in place, and this is not to blame the individual. It's just these are some of the responsibilities that nurses have and they might face barriers to being able to implement these responsibilities, but these are some of the responsibilities. And then nurses are also responsible for following hospital policies and procedures about patient care. Physicians and other prescribing healthcare providers have other responsibilities as well that include making sure that any prescription that they submit to the pharmacy is safe for the patient. They are responsible for the patient's safety and for safe transitions in care. They are responsible also for, reviewing the patient's existing medications and medication reconciliation so that any prescriptions that they make and any care that they provide is safe in that context. And they are also responsible for following hospital policies and procedures of the organization, especially when it comes to patient care. So in this case, the medication reconciliation did not was not successful because the physician did not notice that in the patient's chart was a recent discontinuation of a high alert medication. And pharmacies are another stakeholder in this case, and pharmacists as well. So it is important for pharmacies to be able to, especially the in-hospital pharmacy, to be able to identify an alert about duplicate prescriptions and just remaining vigilant about the different prescriptions that the patients have or that they receive for patients. They're also responsible for maintaining accurate records about patient prescriptions and to follow the policies and procedures in place by the organization. There were the report, again, by the California Department of Public Health did find that, the contracted telepharmacy was not following some of the policies and procedures that were outlined by the organization. So they found, for example, some patient medication that was supposed to be disposed of within 3 months. They found it, on site 2 years later. And they found a few other things that showed that they were not following all of the policies and procedures in place. The pharmacy is also responsible for alerting prescribing providers about any issues with unsafe prescriptions and with communicating with the contracted telepharmacy if there are any issues. So the EMR system and hospital IT, um, when it comes to the Plan Do Study Act approach, they would be responsible for implementing some of the safeguard alerts for duplicate medication administration, for high alert medications, and for double verification. So, for example, they would be responsible for making sure that the safeguard alert for a duplicate medication administration works. So, for example, if a nurse tries to administer Lovenox before the um, the required waiting time, um, the EMR system and hospital IT is responsible for making sure that there is an alert that is interpretable by the nurse and that works reliably. And nursing management is responsible for implementing hospital policies and procedures. So all of the different changes that might be implemented after an event like this, it is part of the responsibility of nursing management to be able to implement these changes and to enforce the changes to the hospital policies and procedures. Patient safety is also a main responsibility of nursing managers. And then being able to implement process improvements is one of the main responsibilities and one of the main roles of nursing management. Hospital leadership is also a stakeholder in this case because they uh, they create or they approve the policies and procedures that uh, a lot of other stakeholders are responsible for following. And so it is important that they create policies and procedures that are achievable or that can be implemented and that are based on evidence-based practice and that prioritize patient safety. And it is also important that they update their policies as needed. The report by the California Department of Public Health found that there were some policies and procedures in place that were antiquated and that did not um, follow the best practices for safe medication administration. Now, for the force field analysis, there are some driving forces and some restraining forces. So some of the reasons to prevent unsafe medication administration of high alert medications include improving patient safety. We want to be able to provide safe medication administration to prevent patient harm. We want to prevent um, duplicate medication administration, and we want to have high standards of patient care. Some of the restraining forces that may need to be addressed that may need to be addressed in order for positive changes to happen include um, staff resistance to change, resource restraints, so not having enough time to implement the new changes, not having enough staff to carry these changes out, high staff turnover. So that means that, um, you know, that there is a bigger need for training new staff and a bigger time cost to that, and lack of pharmacy oversight.